President Ernest by Koroma has received in audience the President of the MSF, Meinie Nicolai, at State House, where she briefed him on her findings from her assessment visit to the Ebola epicenters in the country. Razia Bashkamara again.
MSF, the Minister of Health and Sanitation, Dr. Abubakarr Fofanah, said MSF has been operating before the war. He reported with satisfaction that the collaboration between MSF and government has been one of mutual respect and commended them for being the first to establish a state-of-the-art field hospital in the country. Dr. Fofanah informed the President that since the crisis started, they have shown a great deal of understanding and have even had cause to expand their facilities for a number of times to accommodate the needs of the country. The minister told President Koroma that MSF has been doing a fantastic job even under very difficult field conditions. Briefing the President on her findings, the President, MSF, Meinie Nicolai, said last Friday she was in Monrovia, where their organization also supports the people of Liberia. She further informed the President that they visited the treatment center in Foya, which was a disaster, adding that she has worked for 22 years in the organization. Ms. Nicolai disclosed that her visit to the President is to tell him their findings, concerns, and to share with him guidelines that government will follow.
Another element that I wanted to say, yes, so for us it's important to protect our own workers, and touch wood, we've been successful, we think, so we believe how we work is safe, and we can still convince international doctors and nurses to come to Sierra Leone and to help and to work here. Another problem that we have faced as we are based in Europe was that air companies were closing down. So just for your information, I can tell you that our General Director, which came with me to Monrovia, has been in Brussels, to MSF-Brussels, to speak to the unions and the directors, to convince them to keep the air bridge open to Monrovia and Freetown. And they've listened to us. We've told them the disease is contagious, but not like airborne. So as an air company, indeed you have to be careful. For sure you have to be careful. We're not saying that nobody should be. It is a dangerous disease, and we're the first ones to admit it. But with measurements, we can work with it. So an air company should never take a sick person on board. So that's clear. And that they have accepted. So we are very grateful that they did, and I think it's good whenever you meet the Belgian ambassador. It is a nice thing to tell him things that he keeps MSF-Brussels open, because we believe for Sierra Leone and Liberia, the two countries, it's very important that we keep air contact to bring in workers, to bring our material, especially for personnel.
Welcoming the President of MSF, Meinie Nicolai, President Koroma noted with satisfaction that government is pleased that they are here to see their staff in the field and to assess their working condition, including the situation of the Ebola caseload in Sierra Leone, Liberia, and Guinea. The President intimated Ms. Nicolai that government appreciates their intervention as an organization. He reiterated that they are the first organization to come in and establish a clinic in what they refer to as the epicenter of the Ebola disease in Sierra Leone. President Koroma maintained that the intervention has helped, and the cases of survival that they had has given a lot of hope to the people that are exposed to the disease. President Koroma stated that government has given them hope, and it has also provided them with the usual guidelines on what to do.
There are more checks, you heighten the sensitization, the social mobilization, you involve everybody. Because yes, we have people that will be contact tracers and surveillance officers. But beyond that, you also need the local people in the community to be involved in the social mobilization. They must be involved in the sensitization, and they use their traditional methods to reach out to them. You know. It's a difficult situation, but that is what it is for us to increase the penetration of the knowledge and the sensitization to the people. We have definitely been stretched. You have been stretched. You have a limited capacity, and you can only do what you can within your limits. And even there, you also have to have health workers going in and coming so that you don't allow fatigue to set in. Because of that, and we have, like you have advised, we have been talking with other organizations. The CDC Director General has been here. The WHO Director General has been here. And we believe that we have to stretch out.
He observed that Ebola is new to the nation and country, and it is very strange, which he said is the reason why the initial reactions had been mixed. He maintained that some people accepted the fact that Ebola is real and some were in denial out of ignorance because of the fear and customary beliefs and traditions. President Koroma added that some of it was just deliberate misinformation which caused a lot of mixed feelings and confusion. He said MSF came in and established a center in Kailahun when it was very difficult. President Koroma recalled the difficulties they earlier encountered of not accepting the police nor the military and the denial of the people of the disease that resulted to the fighting of the medical people. President Koroma thanked God that they were able to eventually establish the epicenter at the end. He pointed out that the issues that the MSF president has raised are very pertinent because he has personally visited the centers in Kenema and Kailahun. President Koroma maintained that the kind of protocols that he observed in the center in Kailahun are so rigid that one will even have confidence that he is not exposed. President Koroma said he went through the whole system, including where the patients and staff were without any fear because of the professionalism that they experienced, which was not the case in Kenema.